Welcome to the 315th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Thank you for listening. Well, I made it from Port Charlotte, Florida to Houston, and then 21 hours later in a car with Addie Dulaney Majnaric, the dietitian, and my grandson Caleb and my granddog Haas. 21 hours later, we arrived back in Florida. So welcome, Addie.
Hello, everyone from sunny Florida.
It's not too sunny today, but well, it'll be there.
It counts.
So we traveled. Everybody wants to know what we ate when we traveled. And first day, we thought we had it going pretty good, you know. We had a nice picnic lunch, spread our towel out. And so we're traveling with 14-month-old.
Mm-hmm.
So what'd you cook him?
He loves tofu, and it's quite portable. So I baked his typical tofu we do at home, a big batch of that. Kept it in a cooler on ice with some sauteed veggies. I think we did broccoli is what we're still gumming it a little bit. So our veggie selection's a little limited, but broccoli works well. And lots of fruit. We love fruit. We did some Ezekiel bread with us, type of almond butter for him, or some avocado for healthy fats for his meals, and some of our, kid-friendly cereal puffs and things like that, teether type of cereals for snacks, and a few organic fruit and vegetable bean pouches. So we had a good spread there for all of us, and then we packed. I made us a big pasta salad from the cookbook with loaded down on veggies and some chickpeas and peas and some pasta, and we had a ton of fruit, and then a lot of finger food friendly cut up bell peppers, carrots, and cucumbers. So we had a nice spread for a picnic stop, and then just kind of munching along the way.
Yeah, and, that's what it takes. In the past, I've talked on the podcast before that, the two of us get together, and it has been, what kind of snacks and bad things can we get into when we're traveling? And I think that happens a lot. You go in to get gas, and you start looking around, or you're stopping at rest stops, or looking, what's just right there off the exit, and you can get into a lot of trouble with food, and you're sitting around, you're not moving. So the big bag of vegetables was hydrating, and good to munch on, and that really was quite satisfying.
Mm-hmm.
And then when we stopped and had the pasta salad, and it was just nice. It's not too heavy, and it worked out really good. Day 2, we did find a Mexican restaurant using the Google restaurants along the way, and I called and asked them. Now, a lot of times you can get into a little trouble with Mexican restaurants. Sometimes they do refried beans instead of regular beans, or they may have oil in something, or they may not have a vegan or vegetarian option. And that was the case with the restaurant we ended up actually getting food. I asked she was probably the hostess, and, just looking at the menu, they didn't have much in the way of vegan options. But when I asked, I was like, hey, I see you have, peppers and onions here. Can you possibly, do us a burrito with extra vegetables and not do cheese, not do sour cream? And, scratched her head a little bit. And I think, she waited and she went and talked to the manager. And, of course, when we got there and spoke with the owner of the restaurant, he was, more than capable of making us a burrito with just vegetables. And fresh pico, and it was real good. We got a little bit more avocado for Caleb to have some more toast with, and that worked out good. And so, you just, we like the Happy Cow app as well sometimes. But, I think if you can have good snacks and a lot of fruit with you, it certainly makes for a much more enjoyable trip. We had the watermelon in the cooler, stayed nice. Pineapple stayed pretty good. Strawberries stay good. Blueberries stay good. Bananas do not travel well. But the other option is to always, on Google Maps is so good about finding a Walmart or finding a Whole Foods, so you can stop and load up on more fruit along the way. So
also depends on your route too. I mean, some routes will have even more options than that. So.
Right, and we were on Interstate 10. And the options, yeah, it's pretty desolate. You know, we're talking Love's, truck stop food, and just really, really, really nasty fast food restaurants along the way. So not much in the way of options there. You know, down here in Florida, there's a gas station called Wawa that has a lot of different fruit options and veggie options, and so you know, it just depends on what part of the country you're in as far as what you're going to find. But if you have your own fruit packed, you know, apples travel, and of course, apple, you know,
and staying away from like the prepared stuff, because teaser of something we're going to get into here today is sodium, and if you are getting into more of the pre-made stuff, whether it's, you know, even at a grocery store, really, or at a gas station or rest area or restaurant, you're going to get into a little bit more sodium. And when you're sitting in the car, if you are traveling by car, your circulation's already not the greatest. And, you know, sodium, we can get some water retention on board, inflammation, also spikes some cravings. So, you know, much as we can stay out of the excess sodium, the better. And the high fiber choice of the raw veggies was really awesome the first day, because like you said, it was filling. You're not burning an excess, you know, a large amount of calories. You're sitting there driving, but sometimes to be able to munch on something during a boring drive like that, it isn't a bad thing. And so if you have a low calorie, high fiber option, that does the trick.
Yeah. And it was my birthday weekend.
It was.
Yes, last year in my 50s. So you made me a great pasta dinner, a pesto pasta.
Yes, it is one of Caleb's favorites. It is a pesto pasta white bean base. It was wonderful because Mom here, the doc, has a great garden and a great herb selection of our own. So I was able to pick all the basil and oregano that I needed for the dish. So I'll, you know, six at least big handfuls of spinach, you know, white Great Northern beans, the herbs, and then some cashews. Now you can leave those out if you wish. And then lots of garlic. I like the fresh garlic in this. It gives it a little extra bite because you're not cooking any of this, so you are putting it all in the blender. And nutritional yeast. If you want to do some black pepper or onion powder or things like that, you can. And then a hit of allspice. All of that in your blender with some lemon juice, a little bit of water, and you can do a little plain soy milk or plain almond milk if you wanted. Blend that up into a nice sauce type, you know, consistency. You can do it in a food processor. It may not get as smooth as a high-speed blender, so that's what we did. And put it over some sauteed mushrooms and pasta, and it is delicious.
It was
delicious. Made a lot of it. Got some funny faces of Mr. Caleb hulking out in his green pasta sauce all over himself, but it was great. Yeah, we had that, and then a homemade chocolate cake.
Yes, very, very good. So, and you know, you don't have to. People talk about cakes, but you don't have to use oil like they had, you know, do in the grocery stores and things like that. And you used. I believe we had some chocolate hazelnut powder or chocolate almond powder, something like that you used, and so it was really, really good.
Yeah.
So before we get into our main topic of nutrition and especially in kids, since you're here and we've been watching Caleb eat a ton of food, I wanted to talk a little bit about cognitive decline. Last week I had Jill Bolte-Taylor on, and we talked about brain function and the different characters of our brain. And this week, the diva had some dental surgery done. And to share a little bit of the diva's history, you know, she has atrial fibrillation and she takes a blood thinner. So when people are on blood thinners, often they have to hold their blood thinner for different surgical procedures. Luckily, she didn't have to have any MAC. She didn't have to have any anesthesia. But when we often don't think about in older individuals, and this is greater than 65, we're talking, when people undergo certainly general anesthesia, but even conscious sedation, MAC anesthesia, Diprivan, propofol type anesthesia. It's very worrisome that they may suffer worsening memory, worsening dementia, worsening memory, worsening cognitive function, which can even include hallucinations or, again, rapid deterioration into Alzheimer's. And, my father actually had experienced that. But we don't often think about, those type of side effects from surgery. We often think about what you're going to have the surgery for and don't think about the other consequences. In my mom's case, the big worry was coming off the blood thinner and the risk of stroke or an embolic event or a blood clot. But there was a study done and published recently in the Journal of American Medical Association this month out of the University of California, and I was happy to see that somebody finally looked at this and looked at postoperative neurocognitive decline and the development of delirium or confusion or again different difficulty and decreased level of functioning. And it's thought secondary to the possible, inflammation of the brain associated with either the anesthetic or change in oxygenation, vascular injury, again, lack of blood flow. When you're not breathing, and we've talked about this in the past, taking a good diaphragmatic breaths, carbon dioxide, there needs to be a balance of carbon dioxide and oxygen in your blood. And if you're underventilating or overventilating, it can impair delivery of oxygen to your tissues, but specifically your brain. And then if you have underlying dementia or a bit of decline, it can make that much worse. And they looked at 1,114 patients over the age of 65 and found out that 7% risk of a stroke with non-cardiac surgery, also associated with delirium. Some could be long-term or of significant length of time. Up to 65% of the people had at least 10% some long-term decline in cognitive function. Complicating features, the longer that someone has to stay in the hospital, especially in these days with COVID and decreased family members, they're left in a room. Often they're awakened during the night, or their surgery may occur at different parts of the day, or they may have pain and pain medications, and so their days and nights gets mixed up. So the longer the hospital stay, the worse. If you have to have mechanical ventilation, certainly makes things worse. The longer, if somebody can't get immediately weaned after surgery, that makes it worse. It's associated with a decrease in longevity and quality of life. And in the ability to function at home alone. Some of the other things that need to be taken into consideration in people is, what medications are you on before surgery? People that take sleeping medications, people that take anticholinergic medications for Parkinson's or bladder dysfunction medications, those can interfere with anesthetics a lot and cause problems. Certainly any antidepressants or opioids that are given pre-op, and then after makes all that worse. So, if you have to have a surgery and it's emergent, it's one thing as you get older. But, I always tell people, you want to avoid any kind of elective surgery if at all possible. If you have someone that's older that's having surgery and they have hearing aids, it's very important to make sure that, they have their hearing aids with them, their glasses, because visual aids, if they're, in a strange environment at night, a nightlight, were they able to exercise up until that procedure, getting them up and moving them after the procedure. Anybody that had depression before a surgery, things can certainly get a lot worse. Blood pressure, is something that needs to be taken into control. The glucose. Do people drink alcohol? We have older people that drink several stiff drinks at night, and then all of a sudden they go to the hospital to have a procedure, and they're not having that drink, and they can actually have withdrawal symptoms. And then on top of pain medication, it can make things a whole lot worse. And then nutrition, anti-inflammatory medication or anti-inflammatory foods. If somebody comes out of surgery, it drives me absolutely insane I had a patient that was in the hospital recently, and they brought in bacon the next day. He's a diabetic, and he's, obviously plant-based, and eggs. And, it's thought that, that's what people need are these comfort foods, which actually makes things worse. And then obviously, not having the support of family. So if you or a loved one's going to be in the hospital, you really do need to, you have to have an advocate. If you're going to have a procedure done, or you're going to be in the hospital for any length of time, you really need to call in the cavalry. I tell people, this is the time. This is not the time to wait for family to come in, or it's not the time for you to stay home and see if your parents are going to be okay. It's the time to actually be there to be a spokesperson for the person that's having the procedure that may not be able to have, to be able to make decisions and beat, the stress and take some of the stress off.
And I will say, from personal experience, having been hospitalized during COVID for the birth of Caleb, that having a good advocate is extremely important. And knowing what you're getting into. The days at the hospital now are unfortunately not as they used to be, and not that they were even the greatest right before COVID. Not to bash hospitals or anything, but you need that advocate there, and you also need to know what you're getting into. So if you can avoid it, if it's not necessarily like she said, let's not go there.
And if you do, you want to make sure that you're as in good possible physical shape as you can be before you go in there, by optimizing your nutrition and then optimizing your nutrition afterwards.
Yeah, we kind of talk about with a few of our patients, especially orthopedic type of surgeries that I work with, especially we have a few diabetics, and it's, we refer to their surgery date as game day. And I work with them on how we can really get their nutrition, especially diabetics, your blood sugar, get the movement in that we can, get your blood sugar under control, get that BMI as close to normalized as possible prior to surgery. Really do truly treat it like a game day that you are training for, because the better you go into it, the better you will be able to recover after.
And, we sometimes take certain medications for granted. I think, there's a lot more in the news, and there's some lawsuits about opioid use, and we don't think that there's any other option. And there are plenty other options for pain management than opioids. And in an older person, I can't stress how bad that can be. And in any person, because they are so addictive. And they can cause so much mental confusion. The other thing is sleeping pills. We want to get people to get a good night's sleep, and people are worried about not getting a good night's sleep. But sleeping pills are not the means to a good night's sleep. And they're, the benzodiazepams, the Xanaxes, the Ativans, the Valiums are very addictive, and they are associated with terrible withdrawal symptoms, but also a decrease in cognitive abilities such as visual, spatial ability, and speed of processing and verbal learning. And so again, you add those sleeping pills onto a surgery in somebody in the hospital alone, you can really get into some bad troubles as far as them being able to communicate. I had a friend that her mom was in the hospital, and she was a former superintendent of school. She was, she traveled, she was very well spoken, but with this major surgery that she had and some of the medication, she wasn't able to communicate, and they thought, her level of functioning was poor, and she was treated as such, and all kinds of bad things can start to happen. And the medication interactions, it's really important to know what medications you're on and what side effects they have and what potential medicines that you're going to be given in the hospital. And again, I want to say have an advocate. It's very, very, very important. And don't jump right into, I'm bone on bone, or I've got a disc and I need surgery, or I need something done. Again, there are a lot of alternatives that can be done to avoid a lot of unnecessary surgeries. Meniscus surgery, there is absolutely no decrease in the need for knee replacement later on. There's no improvement in functioning long term. We want quick fixes when something breaks or something is painful, but you have to really take a step back and say, okay, this recovery process may take a while. But you can come out on the other side better. What happened to cause the acute deterioration? You know, I've talked before last year, I threw my back out, and it took a couple months to get things back. But I gained a big insight as far as how to, each time I throw my back out, how to kind of keep myself in a little bit better shape, or what to do to troubleshoot. So that's kind of where, you know, we'll leave that at this time. The Diva is doing well, by the way, and but it just, you know, with COVID, we've had several people that have done some elective or had to go in, and the care, there's, you know, people are afraid, and you can't have an advocate, and it's just not a good thing. So, Addie and I were grocery shopping. And since, you know, poor little Caleb's a plant-based little baby, and, you know, he's, you know, hardly surviving being a plant-based baby, you know, everybody's afraid. Where's he going to get his protein? And where's he going to get his calcium? And where's he going to get his brain function and his cholesterol and all this kind of stuff? We decided, you know, it's like, what is in baby food? You know, how many calories do babies actually eat? What do other babies eat? How do you figure out how much to eat? Because I'm looking at this kid, you know, it's the first time that, you know, well, he changes so quickly, but my goodness, he's eating a giant plate of fruit, of food. He's got a plate of fruit, and I mean a plate of fruit, and then he's got his whole pancake that's a multi-grain pancake with you know, some nut butter on top, or he's got his big bowl of oatmeal that has quinoa and chia seeds in it. I mean, a big bowl, and then it has fruit in it. And it's like, so what do other kids eat? So we started looking at baby food because, you know, when, unfortunately, sorry, Addie, but when you were growing up, it was, you know, do something orange, do something green, do something brown. And you ate a jar, and when, you know, a little bit out of each jar, and when you quit eating, that was it. But nobody thought about calories or anything else, any other nutrients in.
Right, and there's not a whole lot of direction. I have been thoroughly disappointed with any kind of nutritional questioning or guidance from our pediatrician. And I mean, thankfully, as a dietitian, I nerded out when I knew I was pregnant, and then when Caleb got close to start eating food. And there are some really good online resources. If you are pregnant or trying to raise a plant-based baby, I highly, highly recommend 2 RDs on Instagram, Plant-Based Juniors. They have a new cookbook out, as well as some really good, easy ebooks and resources, as well as some pretty pictures on Instagram.
We can put a link to that.
Yeah, definitely. That can really help you, give you a visual aid to this. But the biggest thing when our pediatrician found out that, you know, I had mentioned, they asked if he was still breastfeeding, and I said yes, and we're doing some soy milk too. We're personally trying to get to the 18-month mark with nursing, but we are doing a little bit of soy milk here and there. He's like, oh, soy? That's been shown to decrease nutrient absorption, and, you know, really need the dairy for the calcium. And I was like, you know, there's been no other indication that he is not on par with growth or height or weight. Developmental milestones. We're checking all the boxes. He's a super happy kid. He's a great sleeper. You know, we have some Irish, Italian, Croatian fits from now and then, but other than that, we're doing pretty good. And, you know, it was like, really, the biggest thing that set him off was the fact that I said we're plant-based, and I quickly responded in a tone that my mother, I could hear her using, that I was a clinical registered dietitian who focuses on plant-based nutrition for lifestyle disease reversal and prevention, and I've got it covered, and that quickly ended that conversation. But it was just daunting to me, so I started to look too. It's like, okay, so all these kids who come in, are they questioned? If you're on dairy, cow's milk, it's just fine and dandy. What is in their food? Does anyone question on how they plate their food? And for the most part, the answer was no. And I talked to, you know, a few other moms, and it's like no one's really asked about it. And I do fortunately have some other moms who are more focused on their kids' health and have paid attention to it, so that are a little older than me, for some guidance on that. But it's not questioned. So when we were in the grocery store, we wanted to see what's out there. And it was very upsetting, especially if you wanted to be a plant-based mom raising a kid, if you were just starting with pre-made baby food, there was like no beans to be found in any of the pre-made baby foods.
No beans, and really limited vegetables.
Limited vegetables.
Spinach, butternut squash. There were peas, was closest thing to beans.
Yeah.
Carrots. That's it. I mean, very, very limited. And then, mashed chicken or mashed beef or mashed turkey. And, we saw, well, how much protein do these kids, what are they actually getting in this stuff? And, of course, if you look at cereals, and, is there glyphosate? Are there soybean oil and things? A lot of the cereals are full of sugar as well as sodium. So we started looking at
different things. And so the biggest thing, if you look on, because now we're in the age of knowledge. So I am not parent bashing whatsoever. But if we are going to pay as much attention to what sports team our kid plays on, what school they go to, what YouTube videos they watch, then we should pay equal, if not more, attention to the nutrition that we're pouring into them, because they're not indestructible. We are very concerned with their mental health these days, but really we push aside the physical and throw pre-made foods at parents through marketing, whether it's fast food or what you see in the grocery store, unfortunately. And you assume, as any, parent would, who would put something dangerous, who would put something detrimental in food, especially food targeted at kids.
So there was a study done looking at kids aged 2 to 19, 33,795 kids. And they found that, it was a 24-hour dietary history, which aren't great. They're usually underestimate than overestimate. But they found that 2/3 of the calories came from ultra-processed foods. And only 28% came from minimally processed foods. So, and when we say ultra-processed, again, we're talking about soybean oil, palm oil, excess sugar, simple sugars, excess sodium, all kinds of preservatives and flour conditioners and all kinds of allergens that these kids are getting at a very young age. And if you see soybean oil in something, it is genetically modified soybeans. So we're talking glyphosate and gut microbe dysfunction and a whole other thing. So when and I have people that, again, I'm a grandparent, and it is kind of funny. We kind of giggle. Caleb gets we were traveling, and he got a little fussy, and we're like, is he hungry? Do we need to give him something? And of course, Addie was very particular about what kind of foods we had with us. But, it's easy to want to make your child or your grandchild happy, and a happy meal is not the way to do that. So we started looking what's in some of these things.
Right. And so, again, you think, sodium. That's an adult issue. That's what we see people for, sodium. How bad can the kids' foods be? However, the CDC, who we all know, love, and trust these days, they also looked at a reported study. And so there's a variety of different levels of sodium that is allowed or recommended for various ages. So as adults, we know it's 2,300. We know that it should be well under that, more like 1,500, but that's the RDA. It's the same for 14 to 18-year-olds, but it decreases as ages decrease. So ages 1 to 3, they should be getting less than 1,500. Ages 4 to 8, less than 1,900. Ages 9 to 13, less than 2,200. However, they looked at U.S. children ages 6 to 18 years eat an average of about 3,300 milligrams of sodium a day before salt is added at the table. So that is in these ultra-processed, but also regularly processed, also fast food, also restaurant foods that the majority of people are eating out. So that is before anyone at your house pulls out the good old-fashioned salt shaker and gives you a couple shakes. So that is very hard on their kidneys. It's creating horrible taste buds and cravings later in life for now what I see for my 50s and olders in terms of trying to get them off the salt shaker, and causes extreme inflammation. And we also know that excess sodium intake later on in life, it puts people at risk for osteoporosis.
It's also associated with increased inflammatory disease exacerbations. We know that multiple sclerosis episodes is increased with excess sodium, but hypertension in kids, it's now recommended that kids are having their blood pressure checked and even starting blood pressure medications at an early age. And so, that doesn't need to happen. That just is a matter of looking at the diet. And again, just because a child can survive on these foods doesn't mean that they can thrive on these foods.
And so they also looked at fast food kids meals. So not the adult size portions, but the kids meals can easily exceed 1,500 milligrams in one meal. We looked at the beloved ChickfilA menu, and in a breakfast selection for kids, again, kid-size portion, easily had 1,000 milligrams of sodium in it. Lunchables that came out big time when I was little, I looked at those, and the nutritional highlights were that they didn't have the sugar comparative to other snacks and things like that. But no one's talking about the hydrogenated oils. No one's talking about the ultra-processed preservatives, and then the extreme sodium, well over 600 milligrams in these lunchtime options. And then, don't even get me started on McDonald's, which is nothing real to any of that food. In a 2.5 ounce serving, which is a single serving of the Kraft mac and cheese, there's 560 milligrams, including, other things like whey protein and milk fat and protein isolates. And so, again, everybody has these stars on the front of the boxes or on the menu items that they're meeting kids' calcium levels. Hoorah! We're creating heart disease and inflammation and kidney health function decline with the amount of sodium that we're putting in these kids, in addition to altering their taste buds. Picky eaters come from the foods we're exposed to, and it's not easy. I don't mean to paint a pretty picture. We had a struggle tonight with Caleb. Is he particularly picky? No, but we're exposing him to different foods. Sometimes we hit it out of the park, and sometimes we throw it on the floor. And that's kind of where we're at. And I have to check myself not to get frustrated, but, exposing them to natural foods without adding the sodium helps create good gut microbiome, but also good taste bud practice to help them explore different flavors without it being hidden by sodium. Because later on, when they go to their dietitian, hopefully not for their chronic lifestyle disease, and she tells them that they need to get off the salt shaker and they can't do it very easily, it's because of the foundation we're laying for them. So it's not to beat up parents out there, but if we know better and we do live in the age of information, we should try to do better.
Right. So SpaghettiOs, mac and cheese, all those Lunchables, all those things, not only high fat, high nitrites from the meats, but also high salt. You have to think cheese is one of the highest sodium foods that people can get into. You order pizza from Domino's and you get into high sodium. Caleb happens to like pizza, but it's the pizza that we make. So, it's a veggie pizza. So, again, just think about it. Kids are starting back to school, and what are they going to eat and what are they going to be exposed to? And, it is difficult when they go to parties or they go to other kids' houses. It's one thing. But if you can set the foundation at home and educate them at home on good food and sit down at dinner with them and have a good meal, at least it's a good foundation.
And again, we, as I think every town in America, have a traffic jam around the Chick-fil-A parking lot. And they are seen kind of as a healthier option, I think. But when you look at some of these menu items, we're looking at the Nuggets kids meal. 760 milligrams of sodium in just the nuggets, not their waffle fries, friends.
Not the sugar, like the ketchup and all that kind of
Not
stuff,
the
barbecue
sugar.
sauce and all that kind of
50 grams of cholesterol. The chicken strips, 580. I mean, there's nothing that wouldn't just totally annihilate their sodium intake for the day in a very small serving. And it is very similar to adult food selections out there, that it's so calorically dense that we also lose track of their needs for the day, and they lose track of their fullness cues and their needs because their food is so low fiber but high caloric density that we just kind of throw off all metabolic and fullness cue function that we have at an early age. And we don't realize we're doing it because, most of us out there, we're doing it to ourselves too, but we know better now. Hold these places more accountable. You get to vote with your dollar. It does take extra prep. I spend much more time cooking than I know a lot of other families do, and it may be seen as weird, but in a way it's my service right now. It's the season of life that I'm in to set up my family for success, to take a little time and prep a little bit more. It doesn't have to be expensive and it doesn't have to be fancy, but when you are in control of what you can make, and it can be repetitive. It can be the same week to week because that's what they're getting at lunches at schools. It's a 4-week rotation. If you plan and make the meals simple for you, you can set your kids up for success. Again, not just with their mental health, not just with, social interactions, but also with their health and their nutrition, because we know that what they're doing now is directly correlated to their life and their health as an adult.
A lot of people also will get confused that they think that regular fruits and vegetables don't have these ingredients, and so you need to add salt to them or you need to worry about potassium. But, just pulling up and looking at regular vegetables, most vegetables carry somewhere, even a bell pepper, 40 milligrams of sodium, 220 milligrams of potassium. Even a bell pepper has a lot of vitamin C, but anyway, it has 4% of the RDA for iron. So when we eat plant-based, we're not getting all of our nutrients from one source. If you think the traditional plate with a meat and a vegetable and a potato or a grain, and people think, well, they're getting all their nutrients from, in predominantly one item or 2 or 3 items. When people eat plant-based, they eat a little bit of a lot of different things. And so it all adds up throughout the day. But, all vegetables have sodium in it as well as potassium. So you're getting all that you need with the vegetables just as they are. And then, obviously you're going to come across some salt. But it's just really important not to develop those sodium needs, early on.
Yeah.
And I even got a question from an older adult. I've had a golfer. Apparently they make a sports drink for golfers now that, has a bunch of different substances in, but also has a lot of sodium. There's a pickleball sports drink now that has, sugar and sodium and things like that. We get all that stuff from our food, and it's been shown for athletic events that if you eat a high sodium diet, you'll actually have more trouble with salt than if you just eat a regular salt diet. So if we're going to do a marathon or an ultra, we don't try to stock up on water or stock up on sodium, and we don't even stock up on calories because we're not camels. Just eating a really good, healthy diet allows you to get the nutrients and burn clean the next day during the event. So, just take it into account that you're not doing a disservice if you're not getting in those lines. And it doesn't have to be, high prep foods, simple foods. Kids like, the Ezekiel bread, avocado toast with some, almond butter with the toast, mashed up beans. He likes a plate of fruit.
Yeah.
A plate of different kind of fruit. I've seen him eat blueberries, raspberries, blackberries, mango, bananas, watermelon. and he did finger foods.
Yeah, and we did different veggies, and we were doing some purees.
Rice,
different
pasta,
grains.
different grains. So, he does well.
I mean, the biggest things, yes, calcium is a big need for kids. They do require more fat than we do. So when you look at a whole food plant-based diet, no oil, salt, sugar for adults, your breakdown macronutrient-wise can be anywhere from 70 to 80% carbohydrates and then 15 to 10% from fats and then again for proteins. For kids, they need a little bit more fat. They're growing, their brains are growing and developing, so they need about 25 to 30% of their calories from fat. So we do a little bit more in the way of healthy fats, maybe some oils here and there, but trying to do it mostly from whole foods. And so they need that, but their volume just as adults if on a plant-based diet, is going to be bigger because they need more calories. And if you're truly eating whole food, plant-based, not processed, it's not calorically dense, nutrient dense, absolutely, but you just need a little bit more of it to match their needs.
Perfect. So, in just closing, the reason for this podcast is to share our experience and share what we do in the practice, and let people know that we take care of people like we want to be taken care of, and we look at the data, and we look at the evidence, and we change. I was a traditional cardiologist for a lot of years. I prescribed antihypertensives, statins, a variety of different medications based on the illness. You have this, you get these three things. You have heart failure, you get these three things. Yes, watch your sodium, watch your fat intake. But since becoming more involved in nutrition and plant-based, obviously, I've started to take a harder look at just what do some of these medications actually do to affect mortality and morbidity. Do they decrease the incidence of stroke or heart disease or cancer? Do they cause other diseases? What are the other side effects? And again, there was a recent study, and they pooled physicians, and it's like basic questions. What do you think that treating somebody with blood pressure medications for 5 years, what does that do to prevent cardiovascular events? Does it make you 100% bulletproof that you won't have a cardiovascular event if your blood pressure is well controlled with medication? Does it help a little bit? Does it help a lot? The average doctor thought that it would help about 30%. We know that a lot of people don't take their medications as prescribed, but the range was 10 to 70% improvement or a decrease in cardiovascular events. The reality of it is the absolute risk reduction over 5 years of being treated with blood pressure medication is 0 to 3%. Now I'm going to put my 1,500 milligrams of plant-based whole food nitric oxide producing greens up against that, and I am certain I can do better than that. How about osteoporosis medications, Fosamax, injectables, Prolia? What does that do for hip fracture over the 5 years? Physicians polled said it was probably decreased hip fractures by about 40%. The range was 10 to 60%. The absolute risk reduction for treating somebody with medication for osteoporosis, 0.1 to 0.4%. How about statins therapy for cardiovascular events over 5 years? So if we give somebody statins, do we make them heart attack proof? If we drop their cholesterol, whatever, what do we do? Who do we treat? Do we treat everybody? Now we know kids have high cholesterol. We know young adults have high cholesterol. Should we put it in the water? Physicians pooled 5% risk reduction, thought about 20% averaged. The actual absolute risk reduction, 0.3 to 2%. So if these are cardiovascular disease and hip fractures and blood pressure, these are things that we treat as physicians all the time. We know, again, I spoke earlier, meniscus therapy, meniscus surgery, various surgeries that we do. What is the absolute risk reduction? And I would encourage you to ask your physician, and then I would ask you to see what you can do nutritionally. If you were to lower your body mass index to a normal range, if you were to get the oils out of your diet and lower the sodium that your intake to 1,500 milligrams, get the oils out of your diet and lower your cholesterol naturally, would that not be more protective? And what would potentially be the side effect? Absolutely none. And if these numbers are so skewed, and as physicians we are fooled by the pharmaceutical industry to think that we are saving people by prescribing all these medications, does that not translate into what we are now currently doing with the pandemic? So I ask you to look at the literature, keep an open mind, because every time we do something to somebody, there are risks versus benefits. And to call out your neighbor or to call out somebody and say that everybody should have everything done is absolutely wrong. In certain instances, the risk may benefit outweigh the benefits, but not certainly in everybody. And I think we have to be really, really skeptical. And what are the alternatives? I think if you look at your physician, I look when people are online and they talk about things. If the physician is not healing themselves and not a picture of health and not doing a good job and not promoting nutrition and exercise, then I really wonder whether or not they're just following a said protocol dictated by the pharmaceutical industry that bring the Domino's pizza in each week. For us to prescribe medications or the speaking events or the whatever dinners that are done. So in closing, there is so much you can do as an individual to improve your own health. And it starts right in your own kitchen. It starts right in your own backyard, in your own neighborhood with exercise. It doesn't need to involve a fancy gym membership or fancy equipment. It doesn't need to involve fancy foods. Simple, wholesome foods. If you can grow something in your backyard, a little bit, even your herbs, you know where it's coming from. If you can eat organic and decrease your pesticide intake, it's great. Every time you eat out, you're getting, you're giving up that control to someone. So it has been a pleasure and an eye-opener. I enjoyed every day of watching you grow up, Addie, and certainly if I had to do some things over, I certainly would have changed a lot of things knowing what I know now as far as raising you.
But I think that's part of it. If you know better, we can do better. And it's okay to question because that's how we learn. And
that is true. And, I am thankful for Caleb. He's a healthy little boy, and we're enjoying watching him grow up. And it was a little frustrating tonight because, he wasn't eating our plant food. But, we also had to laugh because he's a normal little boy that some days are better than others.
Exactly.
And so you just keep trying. Don't give in or give up, I should say. Try something different and different days, different things. And
take the wins, learn from the losses.
Yeah. And, as Joe Bolte Taylor would say, run a new circuit. It's just, go to your happy place in your right side of your brain and, enjoy the moment and don't let your thinking brain get too ahead of yourself sometimes. So it's been a pleasure having you here visiting for my birthday week. If you all would like to talk to us more about our practice, please go over to the website at drdulaney.com, doctordulaney.com. You can get our cookbook on Amazon. You can get a consultation with myself or Addie by going over there and seeing what we have to offer. And we'd certainly like to entertain any questions.
Yeah, we talk anything family nutrition, sports nutrition, preventative as reversal of lifestyle disease. So hit us up with all your questions. We'd love to help as many people as we can and get the word out there because, again, if we know better, we can all do better.
Yep, so share this podcast with others. We'd love to help you with your sports nutrition, your mobility, or anything like that. So thanks for listening, and I'll speak with you next week.
Absolutely, and happy birthday.
Oh, thank you. What's your name?
Hey, what's your name?
What's your name? Podcast for 3 dogs and little barking, eh? No. All right. Call it a day. Adios.